Alright, so this is one of my favorite lecture series of the whole course. I'm a bit of a nerd when it comes to cardiology, so I apologize now if I get a little too excited about this. Alright, so the heart is the pump that drives the circulatory system. Its job is to pump the blood either to the lungs or to the rest of the body, and then bring it back to the heart. The reason it does this is so that the red blood cells in the blood can pick up the oxygen in the lungs and then carry it to the tissue, where it can drop off the oxygen and then pick up the waste product, carbon dioxide. From there, the carbon dioxide is taken and dropped off to the lungs, where we exhale it. So the heart's this triangle-shaped organ that sits in the middle of your chest, though the bulk of the heart is actually on the left side. It sits in the mediastinum cavity, wrapped in this sac of tissue called the pericardium, and it's made up of 4 chambers, 4 valves, and 4 different vessels. The heart chambers all have 3 layers. The inner layer is called the endocardium, which is a smooth layer of tissue that prevents blood cells from becoming aggravated and forming clots unnecessarily. So as the blood goes by, it kind of slips through the heart. The middle layer is called the myocardium, which would be the cardiac muscle cells we've talked about in previous chapters. And this is the part of the heart that actually does the work. It does the contractions. The outer layer of the heart is called the epicardium, or the visceral pericardium, so it has 2 names. Above that is a thin layer of fluid, and then that outer sac that I talked about before, called the parietal pericardium. Remember the terms visceral and parietal way back from chapter 1. Alright, so we're going to work our way through the heart in the order that the blood travels through it. So starting off, we have a big vein that carries all of the blood in the body back to the heart. That vein is called the vena cava. From there, it's going to dump blood right into our right atrium. That's the chamber found in the top right part of the heart. The job of the atria is to push the blood into the ventricles, the chambers that are just below them. So relatively, these guys aren't that big when compared to the muscles in the ventricle. They just don't have to push the blood very far. Okay, from the right atrium, we head to the right ventricle. But before we get there, we have to cross our first valve, called the tricuspid valve. So there's 4 valves in the heart, and their job is to stop the blood from going backwards when the ventricle contracts. The tricuspid valve is made up of 3 leaflets, and they're held into the heart by these strong tendons called chordae tendineae. When the right atrium contracts, the valve opens up and allows the blood to go through. But when the ventricle contracts, the valves close up, so blood doesn't go backwards. So now we're in the right ventricle, and we're heading towards the lungs, where the drop of blood can drop off the CO2 that it's carrying, pick up some fresh oxygen, and bring it to the rest of the body. Before it leaves the ventricle, it has to cross another valve, called the pulmonic semilunar valve. And then it's going to head to the pulmonary artery, which carries the blood away from the heart and into the lungs. After traveling through the lungs, the blood heads to the pulmonary vein, which carries the blood back to the left atrium. The left atrium is now going to contract and carry the blood to, you guessed it, the left ventricle. Again, it has to pass through a valve first, and this one's called the bicuspid or mitral valve. There's only 2 leaflets, where the tricuspid had 3, bi versus tri. Now, inside the left ventricle, one thing to note is that this chamber is much bigger than all the others. And if you think about it, that makes a lot of sense. The right ventricle only needed to push blood to the lungs and back. The left ventricle needs to push blood all the way to our toes and then all the way back to the right atrium. So it needs to have a really big muscle inside. When the left ventricle contracts, it pushes blood through the aortic semilunar valve and then out into the aorta, which is the huge artery that carries blood to the rest of the body. Alright, one more part to this video. So first up, what tells the heart to contract? That will be the electrical system of the heart. Electrical impulses start at the sinus atrial node, or the sinus node, or the SA node. All the terms are appropriate. The impulses leave there, stimulating the left and right atrial muscles, and then causing those guys to contract. Then it heads down to the AV node, or the atrioventricular node. This node is kind of special. So it causes the impulses to pause before allowing it to head down to the ventricles and cause the ventricles to contract. Why do we need that pause? Because it allows time for the atrium to contract, push the blood into the ventricles, and then the ventricles have something to contract or push forward. So timing is really, really important here. If we didn't have that pause, you'd have atriums and ventricles squeezing at the same time, and nothing would really happen. A lot of arrhythmias or irregular heartbeats happen because there's a problem with the AV node, or happen because there's a problem with that timing. So from the AV node, impulses move down the bundle of His, and then break off into two bundle branches, and then to the Purkinje fibers. The Purkinje fibers stimulate the ventricles and then cause them to contract. And that's it. That's a heartbeat from start to finish. Every time this happens, we can feel a pulse in various places in the body. The carotid, the brachial, the radial, and the femoral, which is in our groin. Those pulses are all common sites that healthcare professionals will use to assess a patient's heart rate.